Hey guys, it's been a long time.
Hi.
What's the weather? Cloudy as heck, thunderstorms
87.
with a high of 91, and I think that high is over because it's, what is it, about 2:30? We already had some major rainstorms, so when we left this morning to just go out on town, it was 80 degrees, and we come back, hour and a half later maybe, and it was 90 degrees. But right before we got home, we got a major downpour, thunder, lightning, and just flooding rain everywhere. So a lot of people may want to know why it's been so long since they've heard from you.
Life.
There is no way to get everything on one video, so
3 kids.
3 kids, a lot of stuff has happened.
That should be enough said right there. 3 kids.
Yeah, and like I said, maybe we'll touch on a few of those topics in the future, but it'll be like 3 or 5 videos. It won't be one. We won't have time on one video. Can we get back into the groove of things?
I hope so.
And here's the thing. Natalie was telling somebody 3, 4, 6 months ago about us doing this video podcast, whatever you want to call it. And she told the person, this was kind of a way to bond, is, me and her setting up this thing and we having a conversation. Guess how many private conversations you get to have when you have 3 kids at home?
None.
Guess how much intimate time at nighttime when it's bedtime you have, I don't know.
Zip.
Because all 3 of the kids, or at least 1.5, 2.5 of them are always in their bed at night.
Yeah.
So, what would you like to talk about?
I don't know. The first thing we're going to talk about, I guess, is my eyes.
So, this can be an FA, Friedreich's ataxia video.
Yes.
And as you may or may not know, we wanted to sort of dedicate part of this channel to FA and your FA journey, even though it's about kind of like all of our family adventures. And one day when the kids get old enough, and our oldest kid really wants to make YouTube videos, doesn't he?
Yeah.
He is
really bad.
I mean, he makes them.
He sets them up just like Daddy, and he records, and he says, "Hey guys," and
subscribe, like, and subscribe, and all this stuff. Yeah, and he makes things out of. It could be trash. It could be cardboard or a milk carton and toys, and he's making all kinds of things out of tools and toolboxes and baskets, aircraft carriers, and all kinds of stuff like that. Trains. He had this couch back here full of boxes and baskets the other day, and he asked Daddy if I wanted to, ride the train. So he had to move a box out of the way so I could sit on the train, and he was the engine and the whistle and all.
He also, him and his brothers, made like a train out of all their different little toys, and found things to connect each one. And they took it all around the house, ingenious. I would have never thought that.
Yeah, he somehow either tied or wired or hooked on something on each one. So when he pulled that, what is it called? Not the caboose, the main engine. When he pulled it, brain fart here. When he pulled it, the rest of the train went with it. It doesn't matter if those train pieces had wheels or if they were sharp objects, legs on the floor, or just no wheels or.
Yep, they still went.
they still followed behind. And you know what's sad? What's sad is you can go buy a train set at Walmart or Amazon, $20, $50, whatever. You set that train set up how it was meant to be set up, You turn that switch on, and what does it do? It derails over and over again. It doesn't work right. And so that's kind of a sad thing. I don't know. I've just noticed that because he begs all the time, can I buy a train? Especially on Christmas.
He's got ones on Amazon that he really wants bad. And I just won't let him do it yet.
And I'm thinking, you know, when I grew up, there was diners and stuff that had these trains that would go around the diner. You would put a quarter in it, and it would, like, go all the way around the diner. But I knew those type of train sets now would probably cost thousands of dollars, something that actually worked when you turned it on.
My great uncle had them like a track going around his ceiling. They went all around the rooms.
And my Aunt Darlene, her dad used to build models, and he was a perfectionist. So he had all the model cars, the model trains. He built like the airplanes that flew, the gas-powered ones, and you know, I could imagine at one time him having something like that. But I don't know how we got off from Friedreich's ataxia. So, what do you want people to know? Because Friedreich's ataxia is what do you call it? It's progressive.
That's what?
It's a progressive disease that always gets worse.
Yes. Well, yes. Okay, so I did not know, but there was an eye effect that, I guess that would be the right word.
I don't know.
Not sure. I've never read this, but I guess there's something that is common with the eyes when you have FA. I don't know if everyone gets it. I don't know how that works. But so back up to like last summer, and I think we talked a little bit about, or not last summer, the summer
somewhere
before.
in a video, I think I got some of your eye shake on a video, but I don't remember which video it was.
So I went to a regular eye doctor, and he said, "Oh, you have cataracts. They're so bad, you're legally blind." Holy crap, that really scared me. So they sent me to a specialty office, and I saw the cataract surgeon. And she said, yes, you have very tiny cataracts, but they should not be affecting your eyes this way. So at the same time, I believe it was the eye doctor had also referred me to a neuro-ophthalmologist. So I had an upcoming appointment with her. So we went in, and this was like, has it been a year?
I don't think so. Maybe 8 months. I don't know. We've only seen her, 3 times total? So
Yeah. I think December.
But let's also go back and say we kind of wish it was bad cataracts, right?
Yeah.
Because they could probably be fixed easily.
Exactly.
But, yeah, go ahead.
So, yeah, anyhow, I didn't need cataract surgery. She was like, they're too small. Like, you don't worry about that. Something else going on. Well, at the same time, the regular ophthalmologist had referred me to their neuro-ophthalmologist. At the same time, they said, we want you to see her. Well, I already had the appointment. So we went and saw her, and how did she diagnose it?
So you were tested for, like an hour of all kinds of eye tests with the nurse or whatever that was there.
Yeah.
and they gave her,
just like vision and like color.
But it was more. There was more to it.
Blindness
Yeah, and
pretty in depth, but
kind of figuring out later on that color blindness book wasn't testing you for color blindness. She said it was for some other reason, just because they were trying to figure it out, I think.
So it ended up being that I have, which is part of FA, which I didn't realize this until the ophthalmologist explained it. Basically, my optic nerve is thinning. It's called what? I think optic nerve atrophy.
I don't remember what it was.
I believe it's the actual diagnosis.
So you got two issues. You got the shaking of your eyes,
which doesn't appear bad in broad view. However, when I try to focus, like my phone, reading a book, or the computer, my eyes go haywire. And you've seen it. How bad is
it? You know what? It probably depends on the time of day, how tired you are, if you're frustrated. There's probably a number of factors that'll. Sometimes they go. I just say that's normal. I'm seeing it, but I'm not noticing it.
So according to the neuro-ophthalmologist, regular
astigmas, something like that,
with FA goes left to right, it just goes back
into like one direction, back and or whatever.
But mine goes all over, like absolutely, like haywire. Like I've never seen myself, but I can imagine that I look pretty psycho.
I think I have shown you video of your eyes doing that. Whether or not you could focus on the video.
Yeah.
And
so
here is an issue we're going to have doing our video podcast. Hear that knock on the door?
Kids.
So we try our best, when we were recording before, to just take one take. But most likely we're going to have to splice multiple videos together. Okay.
And we're back.
Yeah, this is going to be something we'll probably have to deal with. And we have to grow patience for this kind of stuff, because last year I wouldn't have had the patience. I'd just say, turn it off, let's just throw the camera away. But I'm in the mindset now that I know what we're going to have to do, and we'll try to make it work. Even that dog. Somebody let the dog, probably just now. Did you hear that? I'm sure somebody heard it. Somebody locked the dog in the bedroom, and now he wants out. So the dog's going to disturb us.
And this is like another side note, which we'll get to this eventually. But we've decided to homeschool all 3 kids. So where before we had a little bit of free time, like while they were in daycare, now we don't have any time. They're with us 24/7, and that's it. So.
Alright, so we were talking about the nystagmus.
Okay, so yeah, regular nystagmus was
just in one direction.
Left to right. Mine kind of goes everywhere, so.
And earlier, you said, how noticeable it was or something, and I said sometimes it's always there, but other times it can go wild. You're focusing on me. I just seen your eyes shake 3 times in like 1 second. There you go. And you might can see that on the video. You probably can.
Yeah.
Just keep watching. You'll see her eyes do it. She just did it.
I don't like, everything to me is shaky. And that's what I was trying Like, I guess, like, you plateau out with the atrophy. So there's a medication, but it's not FDA approved. So you have to pay out of pocket, and it's like $500. It's like mega expensive. So that was not an option.
It's a derivative of CoQ10 or something like that, and the dosage is really high. They put you on like lab tests, right, for your livers or something. They said if you get on it, you have to have what, every 3 months or something.
Yeah.
So some people that are rich could probably say, okay, I'll try that. It's,
Right.
Start out at $200-$400, and I think your biggest dose is probably about $500-$600 a month. So that's one issue, and then the other is the optic nerve.
The optic nerve, like, I haven't, or I don't feel I have lost a lot of vision. There's maybe some damage in there, and I was telling the eye doctor this last time I saw her. It's almost like at certain times someone sticks, I said a coffee filter, but that's really too opaque. It's more like a bag, like a
something opaque.
Sandwich bag, like over my eyes, like, so everything is kind of like, I still see everything, but my vision is not clear, but the eye shaking, it's like insane.
So when your eyes shake more, if you normally would see letters or whatever on the wall or mirror, whatever they're showing you, you can't
still
focus
at all. I can't focus in on them. So, like this last time I went, like this past month, I couldn't see anything. Like, I knew there were letters up there. I saw like black lines, but I could not focus to read it at all.
Let's go back to that first visit with the neuro-ophthalmologist, and we forgot your glasses. Guess what? No matter what they did, they could not find her, what is it, the reading strength or whatever? Your eye, they did the computer that normally tells you what your vision is, and they tried to do it manually, and they couldn't get it. Probably because of the eye shaking.
Yeah, because like that muscle.
It tricked the computer or whatever that normally predicts that. So the next time we brought the glasses, and you seem probably a little bit better.
Mm-hmm. A little bit.
But it also gave them the opportunity to see what your eye vision is.
Yeah.
Based on previous tests.
So we
Uh-oh, here we go again. Here's another. Oh my gosh.
And we're back.
Oh, and now we got dogs growling at each other. So we had our small pug, Rufus, get locked in the ring. Now the dogs are fighting. We had our middle son bother us twice since we did this, knocking on the door. And we had our youngest son, which I don't think he bothered much. He just kind of walked in and walked out. Except he's locked Rufus in the room and made him squeal. All right, so where were we? Every time you go, you get a bunch of testing, right?
So the second time I went back, so there was the atrophy of the optic nerve, but they also had to check my retina. I don't remember for what.
Was that where they? Ooh, is that where they turn the lights off for 10 minutes or something? Or
so
20 minutes?
it was and I had electrodes on my eyes, and I could feel them and they burn.
Actual wires that are on top of her eyes.
Across my eyeball. It was god awful. Kind of scary, pretty scary actually. But I did it and think, oh, my retinas are fine.
According to the doctor, your eyeballs, your eyes are great. But your optic nerve isn't in your actual eyeball.
Yeah, like my eye health itself is great.
And your nystagmus or whatever is, what did they say, muscles? The muscles around your eye?
She thinks it's the muscle. I don't really know if they even know yet. That was the second one, and then this last visit was in June, and on the second visit, she had tried giving me muscle relaxers, baclofen. Tried to tame it down, did not work at all. Did nothing for it.
It had maybe some other effects.
Yeah, like it kind of made me dopey and knocked me out.
But I think 1 or 2 days you did wake up and say, maybe the baclofen's helping, but every other time you took it, you said it's not. It may make it worse. Is that what you said? And hydroxyzine.
Yeah, I kind of feel that way with like hydroxyzine. Benadryl, like anything that's like sedative.
And they said gabapentin could also help or hurt it, It's, gabapentin might help. Let's try it, but it could also hurt it. But you were on gabapentin anyway, so.
Right. So, the medications were not doing anything. And again, the vision itself, I don't feel has really changed. Get every now and I slightly see like little glimpses of like, oh, my eyes are working. But like for the most part, it's just shaking and like I can't focus like that. I don't know how to say it. Like can't focus at all. So at this last visit, she said, okay, well, the medications are not working. So our next 2 steps are procedures.
And one of them may not be guaranteed to be available to you, if not both. We haven't talked to the person that
I see the actual surgeon next Wednesday.
So the first one is, what do they do? Botox.
Botox injection.
Botox around the eye to deaden the muscles. For what they say, 2 or 3 months, and then it wears off. So even if this works, it'll be a lifetime thing to get these injections. But the next one, which is more kind of scary, because you think they're permanently rearranging or clipping something, is
muscle surgery.
Rearranging or the muscles around your eyes, like in
like
a real surgical
them.
Procedure. What happens if something goes wrong? Facial paralysis or paralysis. Paralysis. Thank you. I got a brain.
Yeah, that was like really, really scary.
And you probably not going to happen because somebody is a doctor or a surgeon for a reason, but stuff like that does happen. You seen, we were watching an episode of Dr. Pimple Popper the other day, and this guy's brother or sister had a procedure, and like they clipped the wrong nerve around the eye, and it said like one side of his face is paralyzed. I probably shouldn't even said that in front of you, right?
No, because I didn't see that.
So he had like a tumor or something around his eye, or right outside of his eye, and he was scared the same thing was going to happen to him. I'm assuming it didn't happen, or they probably wouldn't have aired the episode.
No, that was their hypothesis.
Okay. Yeah. But, you know,
Yeah,
anything around your eyes, surgery is going to be scary.
Yeah, to me that's pretty dangerous. But I don't know. We make it in there and he'd be like, "Oh, it's a piece of cake."
But yeah, you know,
So
we don't know if he. You know, what if he goes in there and says, "Don't even try Botox. Let's just have the surgery." Would you say, "Let's try Botox first"?
I don't know. I want him to explain both of them.
Yeah.
Like, what are the risks? And
is it an outpatient procedure, or do you stay there to make sure everything's
right?
right?
Like, are there benefits? Like, what? Because she didn't seem to know much about it at all. Like,
you know, they kind of up there, which is UF Health. Am I supposed to say where it is? You know, the most world-renowned, I guess, place and hospital, teaching hospital, and people there seem to stick to their specialties. You know, like it's like if you go to a private dentist that has no affiliation with these big universities and stuff like that, they will kind of go into like minor surgeries and all kinds of stuff like that.
yeah.
But you go to UF and you're going to a specialist for everything.
Yeah, like, I feel like I'm in the best hands I can possibly be, and, like, that I can't complain about.
And even though that's kind of off topic, talking about dentists and all, like my cousin Shelia, I guess, was hosting families to do dental procedures. And guess what? You go to one place in Germany and you get everything done at the same place. You don't have to go ship your molds of your teeth out or whatever to 300 miles away and pay thousands and thousands, tens of thousands of dollars for dental work. You just go there and they actually do your implants or whatever in one day, unless you have to have a bone graft or something. And that's amazing because they don't charge you hardly anything, even if you're American and don't have the insurance benefits in Germany. You can go with a couple $100 and get thousands of dollars worth of work. But that doesn't happen here.
No.
It would be nice if it did, but there's too much money to be made here. That's why a lot of dentists from Germany, India, all these other places are working in America. Oh, are you getting tired? Okay. You know what? I forgot about that. That's what she's like world renowned for on these video podcasts. She just yawns like crazy sometimes.
Yep.
And when the camera's not rolling and she's talking to me and I start yawning, boy, Natalie gets mad, don't you? Like,
Whatever.
and now I should say now I'm getting mad at you, Natalie. You're yawning.
I'm not ignoring you though.
So we don't know what choices could be made.
Yeah, so say a little prayer for me, like, whatever. And Wednesday or Thursday of next week.
Yeah, so where's our green screens and our high production stuff, you know?
We're not quite there yet.
We do have 200 subscribers, though.
Woo!
Okay, I think the kids are pushing us to stop, so...
Like this video.
Subscribe.
Subscribe to our channel.
Take care, guys.